I would like to remind all of you that this program is for information and educational purpose only and doesn't substitute professional medical advice or consultations with healthcare professionals. It's important that you consult with a doctor before you make any changes to your treatment plans. 我想提大家呢個節目咧係 for 一般健康信息，唔代表專家嘅醫療意見。當你改變你嘅醫療計劃之前咧，請你諮詢你嘅醫生。Now, let me turn over to Dr. Ho.
Hello, good afternoon. It's good to see everybody. And thank you to Eliza for translating today.
侯醫生歡迎大家，同埋我一陣間會幫侯醫生翻譯做中文嘅。
Today, wanted to talk about COVID-19 from my perspective as an infectious disease physician.
今日咧，我個講座主要係我對呢個新冠流感嘅觀點。
So basically, throughout the COVID-19 pandemic, I've really been seeing a lot of COVID-19 patients in the hospital, and then sometimes when they come to the office, because my specialty is as an infectious disease physician.
係啦，我個職責咧就係主要係專注於傳染病嘅專科。我通常工作喺辦公室，同埋要同病人接觸嘅。
So early on in the pandemic, my family was impacted, and unfortunately, my uncle died from COVID-19. Recently, when the United States passed 1 million deaths, they profiled the story of my uncle and aunt and what they went through.
喺呢個疫情初期，好不幸，我個 uncle 咧亦都因為新冠而離世。最近美國啱啱過咗100萬人嘅死亡。喺華盛頓郵報有一張文章提及呢一個事件。我個 uncle 嘅資料亦都喺呢個文章有提及。
So just wanted to talk a little bit about COVID. SARS-CoV-2 is the virus that causes the disease COVID-19. And since my uncle died, we have a lot more tools, such as the vaccines. And it's still very important to wear the mask and to wash our hands. The incubation period is 2 to 14 days, and the symptoms can depend. People can have fever, cough, shortness of breath. There's a change in taste or smell, fatigue, achiness, headache, sore throat, but everyone's a little bit different. And it's important to diagnose through a COVID-19 test.
好啦，咁我哋讓我哋講一講新冠病情。新冠流感咧係由一隻新冠病毒叫做 CoV2 而導致有疾病嘅。平時我哋需要戴面罩啦、勤洗手同埋打疫苗。咁喺我 uncle 離世之後咧，我哋已經多咗好多預防嘅設施。呢個流感通常係2至14日嘅潛伏期。病徵好唔同，人人嘅感受都有唔同嘅病徵，包括有發燒、咳嗽、呼吸急促、味覺同嗅覺失調，又會有疲憊、身體或者肌肉疼痛、頭痛，甚至喉嚨乾涸。我哋需要測試嚟驗出呢一個病嘅。
So first, I want to talk about COVID-19 tests. To diagnose, you have to test, and then nowadays there's treatment to give early on.
係啦，我哋其實治療嘅第一步咧，就首先要做一做嗰個測試。
There are many free COVID tests from the US government. You can call them, you can go to the website, and more.
我哋咧政府個網站有好多資訊嘅喎，好似而家你熒光幕上邊你可以影幅相睇到，你有時間可以瀏覽下。呢個通常係講關於幾時會有測試，家庭測試。 我哋最近5月30號第3輪嘅免費測試咧已經派發咗出去啦。
In addition, it's very common to take a COVID-19 test at home. One of the important things is you just have to make sure the test is not expired. And if your symptoms are still suspicious for COVID-19, you might need to get a better PCR test. The website link at the bottom talks about additional common questions about at-home tests for COVID.
通常咧，我哋喺呢個政府網站食物管理嘅網址嗰度咧，會睇到有邊啲製造商啊，邊啲品牌嘅測試劑咧係比較有信譽。咁大家買到翻嚟之前咧，最緊要 check 下佢個過期日子仲有冇效。咁若果你有陣時喺屋企測試到係陰性嘅，有陣時未必係正確嘅喎。若果你有症狀，你需要可能要做多一個更加詳細嘅叫做 PCR 測試，俗稱核酸檢測，去揾清楚自己究竟有冇染病。
Next, I want to talk a little bit about COVID-19 treatment.
跟住咧，我想講一講新型冠狀嘅治療方案。
There is a very common medication called Paxlovid, and it is the #1 recommended medication if you're an outpatient at home. However, not everyone can get it. For instance, if you have severe kidney disease, or if you have severe liver disease, or if you're on certain medications that interact with this.
跟住落嚟咧，我想講一講一啲治療嘅方案。有一隻藥現時嚟講係幾有效，叫做 Paxlovid。佢係一隻抗病毒藥，但係咧唔係人人都適用嘅。若果你有肝臟嘅問題或者腎臟比較嚴重嘅問題咧，就要同醫生商量咗先啦。咁呢個藥要需要你個病狀出現之後5天內就要服食先至有效嘅。
As an outpatient, there are other medications. However, most of the time, remdesivir is hard to arrange as an outpatient, so sometimes people need to go into the hospital. There's also an IV medicine, which is the second one, and then another pill medicine, which is the third one.
另外門診咧，你睇醫生可以攞到個藥咧，有呢3隻瑞德西韋啦、貝特洛維單抗同埋莫魯匹韋。通常呢個瑞德西韋咧係要見醫生，醫生寫紙先可以俾到你。另外嗰2樣咧都係要喺醫院度同醫生攞先攞到。
And then, unfortunately, if you're hospitalized, your treatment depends on if you're on oxygen and how long you have had symptoms. I have various names of medications listed here, and sometimes different physicians need to help take care of you, and how sick you get really can vary.
係啦，至於需要住院嘅病人咧，我哋嘅醫療方案有一系列嘅藥。大家喺個熒光幕上邊見到呢4種好普遍嘅藥，係要視乎病人當時嘅血氧量夠唔夠啦，同埋佢個病情個進展係點樣，先去確定佢應該用邊一隻藥嘅。因為有唔同嘅氧氣水平咧，就會影響到個醫療方案。
Next, I want to talk about prevention of COVID.
跟住咧，我想講一講新冠流感嘅預防方案。
First of all, many people who have lupus are vulnerable, so you basically have to do more to protect yourself. And other people who might be in your same house also have to do more in order to protect you. We talked before about washing our hands. The mask should be what we call high quality masks. And you just have to be careful and smart about not going to a crowded area. Of course, as we've talked about, it's important to know when you can get COVID vaccines and the boosters.
通常若果患咗新冠流感嘅人咧，係非常之脆弱。呢個時間咧，你要加倍去保護自己，同你同住嘅屋企人咧，佢哋亦都會加倍咁樣去照顧你。 咁我哋第一要留意，當然係手部衛生啦，經常洗手，戴高品質嘅口罩，同埋要避免一啲公眾群聚嘅地方，多啲留喺屋企。你熒光幕見到個網站咧，就係疫苗同埋加強劑嘅資訊，最緊要肯定自己係疫苗係打得夠時期嘅，跟得上同步，保護自己。
There are different places to find a vaccine, such as from the website, and you can text a number or you can call a phone number. But in general, you can find vaccines at community sites, sometimes the hospital, local pharmacies, and there's also different websites for New York. As many people are probably from New York, I am from New Jersey, and there's a different website link for that.
大家喺熒光幕見到嗰個官網咧，就係關於接種嘅地點、接種疫苗嘅地點，亦都可以用短信將你嘅郵區號碼輸入去4382829咧，就會見到你屋企附近邊度有接種站嘅啦。亦都可以打一個免費嘅800電話。通常喺社區中心、醫院同埋藥房咧都設有疫苗接種站嘅。喺紐約同埋新澤西州兩個網站，亦都可以揾到更多嘅資料。
Next, I want to talk about what I look for as an infectious disease doctor.
跟住落嚟咧，我會講講作為一個傳染病專科，我專注要做啲乜嘢嘅咧
？For instance, in order to know what is going on about COVID-19, I read a lot, such as from the CDC, the WHO, and certain publications such as Reuters, NPR, and more. Also, wherever you live, it's important to know what's going on in the community, such as the number of cases in the county, the state, the region. Since I work in the hospital, I know the number of cases in my hospital. And it's always important that even though we live in one part of the United States, it's always important to look about what's going on for COVID variants in other countries.
好啦，作為一個傳染病專科咧，我第一樣嘢就要每日要睇下呢一個突發新聞，有啲比較有信用嘅網站，譬如世界衛生組織啦、路透社或者疾控中心、國家公共電台等等呢啲新聞網站咧，都係比較有信任啲嘅。咁另外喺本地喺縣、州同埋地區性嘅數據咧，我亦都要留意，尤其是我工作範圍附近嗰個縣，日日都要睇住每日嘅感染率有幾多，死亡率有幾多，對我工作咧係有直接影響。除咗美國之外咧，我亦都會留意其他國家，亞太區啊或者歐洲區，佢哋嗰個疫情發展情況點樣，佢哋有冇啲咩新變種，我哋亦都要歷歷在檔案嘅。
In addition, I look to see in my region which COVID-19 variants are going on, and I can then see what is common versus what is climbing in percentage. In this website, the region is called Region 2, and then we also know that the most common COVID-19 variant in this region is currently called BA2.12.1.
我其中要關注一樣嘢咧，就係疾控中心佢入邊有一個追蹤新變種病毒嘅零件。咁我特別留意咧，喺我工作個區之內就叫做第二區。呢個第二區係包括紐約、新澤西州、波多黎各同埋處女島嘅。咁我會知道有新變體係咩 number 同埋最多係邊一隻。呢個網站就係幫助大家追蹤呢啲新變體病毒嘅。咁現時喺第二區入邊咧，最常見就係 BA2121呢一隻變體。喺5月21號為止咧，有58% 都係由呢一隻新變體 引致病毒嘅，引致生病。
And so it's important to keep up and understand who is a vulnerable population, such as the immunosuppressed. It's important to educate about medications and for patients to keep up to date with COVID-19 boosters. And also it's important to know about a little bit about COVID-19.
好啦，何謂弱勢社群咧？就係一啲有免疫病啊、有前科病或者比較年長、特別年幼嘅朋友。咁我哋咧需要要保護自己，打疫苗咧係第一個先決嘅條件。
Next, I want to talk about long COVID, which is also known as post-COVID.
跟住落嚟咧，我想講一講乜嘢叫做長期新冠病徵，同埋康復之後嘅情況。
Basically, this means that somebody was diagnosed with COVID-19, and then after that, they could continue to have symptoms that last weeks to months, and we're still learning, but it could be years. There's various names for long COVID, but in 2021, it was recognized as a disability to have long COVID.
其實長期新冠嘅定義咧，就係當你染疫後喺個病徵仲持久到數個月至到數年嚟為止咧，呢啲就概括為長期新冠。佢亦都有其他嘅名，可以叫做長途新冠病毒，或者叫做感染後遺症，有啲叫做慢性新冠。咁喺7月2021年咧，美國殘疾人法案命呢個長期新冠為美國殘疾法案入邊嘅其中一個病例。
Unfortunately, people who have long COVID could have any of these symptoms, ranging from tiredness to shortness of breath, feeling like they can't concentrate, pins and needles, just unexplained symptoms. And the best way to prevent this is to make sure that we stay up to date with our vaccines and boosters. The other thing is that it's important to see your doctor because sometimes we need to make sure there's nothing more serious or if it's related to your lupus, for example.
好以下咧就係長期新冠嘅病徵，包括疲勞不適啦、氣促、咳嗽、胸痛、發燒或者心跳加速，有時候集中力咧會出現問題，一般所謂叫做腦霧，就係諗唔清嘢或者集中唔到精神。睡眠嘅時候有困難或者會有頭暈、味覺、嗅覺嘅變化。情緒方面會有抑鬱或者焦慮，手腳咧可能會有麻痹，好似俾針拮咁樣。可以有啲人會有胃痛啊、關節痛啊，有時甚至有皮疹。有啲症狀咧係無法解釋，就係覺得唔舒服咁樣嘅。咁我奉勸大家咧，希望可以喺疫苗加強劑嗰方面盡量做到足嚟保護自己。如果有啲咩症狀係冇辦法停止嘅時候，就一定要去睇醫生，睇下究竟係新冠啦，抑或係同其他潛在疾病有關嘅。
And just some additional resources are listed here. In addition to these websites, it's important to talk to your doctor.
係啦，我呢度咧就提供一啲好有用嘅官網，呢啲資料係可以解答你一啲關於新冠嘅問題啦。如果你最後嘅最佳方法就係去揾你個醫生。
And so I came up with a checklist, which includes keeping in touch with your doctor, testing to see you have COVID, and then getting treatment, making sure that you're up to date with the COVID-19 vaccines and the boosters, and then talking to your doctor to see if you qualify for anything for prevention or treatment.
好啦， 我同大家分享我有一張清單，點樣可以保持健康嘅。第一就要同你嘅醫生緊密合作，保持聯繫。第二咧，有唔妥嘅時候就要做測試，同埋盡快得到治療。亦都要I haven't finished。亦都要按唔同嘅年齡層同埋你嘅潛在嘅疾病去接種疫苗同埋接種加強劑，要保護你自己同埋你同住嘅人，亦都要同醫生傾下你有冇資格去獲得一啲新嘅預防或者治療方案。
And then it's important to wear a high quality mask. For example, I wear a very strong N95, and then on top of that, I wear another mask. And then on top of my glasses, I usually wear another eyewear over this. I also avoid large in-person gatherings. I put a lot of websites in the slides, but you have to keep checking them because they do get updated. And I'll stop there, but thank you again to Eliza for translating. I'm always very impressed.
我身為一個傳染病醫生咧，我當然係要特別注重保護自己啦。我經常會戴住面罩，仲要係戴一啲高質素嘅 N95面罩，同埋我自己本身係戴眼鏡，我亦都會加多一個面罩咧喺我眼鏡之上嚟保護。我亦都唔會去啲大型嘅場合、人多嘅聚會。咁咧，我啲頭先同大家分享個網站。當你哋去瀏覽嘅時候，要留意下佢哋個更新日期喎，有冇係最新嘅資料？好啦，我今日嘅講座到呢度為止啦，我會將時間交俾下一位。Thank you, Cindy. Thank you very much.
So as mentioned, today for Lupus Health and Wellness Day, I am a rheumatologist at the Hospital for Special Surgery. So I wanted to speak with everyone a little bit, just very briefly on pointers to note for our patients with lupus. And thank you to Eliza for helping translate both the slides and most of what I'm about to introduce. So some of these things I realized that Dr. Ho went over before, so we might go a little faster on those. Okay, so just the first thing I wanted to briefly introduce is just in general, when we think about COVID, sort of where we're at right now. So first of all, these do come from the CDC website, which is a useful resource for looking at numbers or data. So this is what I use sometimes to think about how the status of cases are locally. So you can see that you can find both information based on where you live in the country and also just in the country as a whole. So to the right is more specific to New York and specifically New York County, but it can give you sort of a sense of how many cases are currently going on, how many admissions, so how many patients who are sick are going to the hospital, and then how much hospital resource is being used for COVID, which again is very specific for most people, but for me is a sense that tells me, as you can see in the graphic, about 9 admissions for every 100,000, which is an improvement from earlier, of course, in the pandemic. Below then is a graphic demonstrating in general updates on our country as a whole. How are we doing? And if you can note that this is updated pretty regularly every day at a certain point in time. Again, this is very specific information, more useful to me, but it does, as you can see in trends, illustrate some of the changes that are happening over months. So things that I wanted to point out is that in general, you can see that more, of course, fatal cases of COVID are going down. And then our vaccination rate nationwide is roughly 80%. So these data do give us just a sense of where we're at. And compared to earlier in the year, and especially in March, when our hospitalization rate was much higher, I think in general, we can inform ourselves that as our vaccination rate has gone up in the country, we're seeing just less severe cases of COVID in general, even if there are still ongoing cases. Eliza, I don't know if you wanted to summarize that a little bit.
Oh, can you repeat in Mandarin?
Yes, I can repeat some of it. On this slide, 我想给大家讲的就是 CDC 国家的这个 website 上，有很多那可以看见就是大概从去年到今年的 COVID case 的变化，今年到现在我可以讲的就是大概现在有疫苗的 rates 就比去年要高一些，然后更 severe 就更严重的 COVID case 现在是越来越减少。Okay, so just moving on to the next slide. I do want to go ahead and just introduce some very basic pointers for keeping healthy. So I realize some of this we already talked about in our infectious disease slide. So, but of course, in general, the tips are going to be still most important to really just engage in hand washing. So lots of hand washing, whether you're out or you're coming back home from being out. It is still the #1 way to reduce infection rates, regardless of the kind. So even now, that's still very important. Also remains to be very important to avoid very crowded areas. This is, I think, in general, good advice, but especially if you have any conditions that weaken your immune system, then I think it's even more important to think about this. I get a lot of questions in my clinic regarding diet and what one should or shouldn't eat to keep healthy or decrease chances of sickness. I will say that in medicine, there are very few strict studies on what diet is best, but in general, I'll say that a balanced diet is still the best way to go. Otherwise, keeping healthy, just reminding everyone that physical, of course, health is important, but also mental and spiritual health is important. So just a reminder, of course, that during these times, it's important to speak with family, just keep connected with family and friends and other connections that you have. And then also not to forget to really be able to engage in activities that are important for you and that you enjoy. So 讲到就是大家注意健康的一些points，就是洗手还是最重要的。Even 现在even with COVID，不管是在外面还是现在从外面回家，能经常洗手还是会很帮助的。大概我想给大家讲的，也就是人数比较高的一些地方还是得注意。要是戴口罩的话，还是应该的。尤其是要是我们有lupus 或者别的这种condition 可以让我们疫苗 system 比较低的话，还是得注意一点。人数高的一些地方应该不要太经常去。在我的诊所里，很多人会问我，你大概该吃什么东西，吃什么喝什么可以帮助我们maintain健康。我想讲的就是还是比较balance 要更好，也就是说注意大家应该吃一些粮食的话，就是肉菜应该都吃一些，不需要说有一些东西是不可以吃。要是的话，就是健康除了 physical 的健康我觉得就是我们得注意，就是心理上也得健康。也就是说，我们应该经常跟家里跟朋友多了解现在尤其是现在。然后要是自己比较喜欢做的一些事情，像太极或者 yoga 或者画画，这些都还是很重要。现在应该可以做一做，这样子帮大家是wholly can be healthy overall， 不光是说的就是健康身体健康。So just continuing some of the things that I from the past slide is again goes along with avoiding crowded areas, but being in open spaces, that is one way that we can enjoy being outside without being in crowded areas. So I mean by that, like parks or anywhere that you can walk that you can get lots of fresh air. Even if you're vaccinated, another important question that I get is, do I still need to continue masking and avoiding crowds and social distancing? And the answer is yes. So the vaccination is like a layer of protection, but it is still very important to make sure that we are watching all the other things that are important for preventing infections. And then finally is just another point now, especially is I'm glad that we have at-home tests available. And so I think it's very important that we be able to have one or two at home. That way, if you're feeling like you have symptoms, then it is better to be able to have a test and be able to try and do that at home before going outside to a clinic.所以就像刚才讲的话，为了大家健康的，要是想在外面，我觉得还是人数高的一些地方应该avoid。So 要是可以到公园啊，就是比较 open 的 space，有新鲜空气的地方，还是可以走一走，这样子也是比较安全的。要是已经打了这疫苗针 vaccination， 还是应该很重要，就是注意戴口罩然后不要到人数高的一些地方。所以就算你打1针或者 hopefully 2针或者 booster 的话，还是这些应该还是注意的。最后的 point 就是现在我们也可以用 at home 的 COVID test， 所以有些这些 test 可以在家里现在有这些 pack， 应该在家里注意，要是有1、2个还是这样子比较很方便。要是觉得自己发烧或者不舒服的话，可以在家里先 test。所以这样子就不需要经常出去。要是觉得自己不舒服的话，还是应该跟你的医生早一些时候去通话。Okay, so the question, of course, is specifically, as I mentioned, for lupus patients, what should we be doing? And a lot of these things are similar to the things that we have for general population, but it's just more cautious. So briefly then, what is lupus for those of you who either are not familiar or just hearing about it? Lupus is essentially a chronic immune disease. It's a chronic immune disorder. It means that essentially your immune system, instead of fighting outside foreign materials, it tends to attack your own body. So it does last for quite some time, but it is very manageable now with medications that we have. But it is a disorder of the immune system that will sort of attack all sorts of parts of the body. So since that is the case, if you do have lupus, what is it that you really want to make sure that you're doing, especially now? So number one point is to make sure that you're actually treating the lupus. So essentially, it's making sure that your lupus is well treated and that you're seeing your rheumatologist pretty routinely. Because of course, lupus on its own can actually predispose you to other conditions and especially infections. So it's important to make sure that you're seeing your doctor. Then I also get a frequent question of, if I have lupus, should I be getting the vaccine series? And the answer is absolutely yes. So in addition to the primary series, we do recommend through our ACR National Rheumatology Committee that you do also get the booster. So after your primary series, getting an additional 1 or 2 booster shots, depending on your lupus status, is still very recommended. So the question is, I also get is this really helpful and what is it really doing? So certainly we know that patients with immune systems that are weaker, such as from lupus, are at high risk for developing COVID, and especially more serious cases of COVID, meaning that they tend to have more hospitalized cases and more like bad outcomes. So because of that, we want to protect them more. So getting the vaccine dose improves their immune system response to COVID. And they have basically a less case of having more serious cases of COVID. So then the other question I get very frequently is, what about side effects? So the side effects to the booster doses are very similar to the primary doses, as it's the same medications. So that means that you may still expect either nothing in some cases, you may feel just fine, or you might have some sore arm or some muscle aches, or you might feel a little bit feverish and sick for 1 day. That is actually good. It's a sign of your immune system working against and responding to the vaccine. So as always, if you have lupus, if you have any other condition for which you see a rheumatologist, I would recommend that you talk to them before scheduling your next vaccine dose. And the reason being is that there can sometimes be changes to your medication or just other pointers that they need to remind you about. So. Okay, so 在这个 slide 上，我想讲的就是，要是我有 lupus 的话，应该现在怎么去manage 第一呢，就是想给大家讲讲，要是不太跟 lupus familiar 的话，lupus 是一个就我们叫的红斑狼疮，是一个immune system rheumatology condition，就是你自己的疫苗免疫系统在打自己，instead of 去 attack 外面的这些不同的virus，instead 在不同的原因的话，你自己的免疫系统在attack 我们自己，所以为了这个呢，很重要，应该去看一个专科医生，这样子可以 make sure 我们在treating lupus，然后这样子很重要。要是有 lupus 的话，现在第一个最重要的 point 就是应该经常去看一看你的医生。要是你没有有 lupus，然后没有一个分尸科的话，我还是建议你去，当然去，在纽约有很多不同的分尸科医院，应该还是去见一个 rheumatologist， 这样子的话，我们可以把 lupus treating better。So， 要是有 lupus 的话，应不应该打疫苗针？我经常会听见这些问题，说一定要打。通过我们的分尸科 society，右边的这个 ACR， 我们觉得是很重要。有红斑狼疮的我们的 patients 的免疫系统是比较低，已经是比较低，所以这样子的话，我们必须要make sure 打了这个疫苗针可以improve 你的打 COVID 的 response。所以除了打第一针和第二针的话，booster dose 还是应该去打 also。很多人也会问我有没有就是有没有 effective， 还是应该打上到第4针的话，你的 protection 会再增加的话，所以要是已经打了第一针和第2针，我还是建议跟你的医生还是去讲一讲，说应不应该打第4针。这样子的话，我们可以schedule 一下，然后可以更 improve 你的COVID 的 protection。Also 有很多人会问我side effects。怎么样？side effects 跟between booster 和第一针和第二针会很 similar， 会很像，所以可以expect 你要是对第一针、第二针没有什么反应的话，也有可能 booster 没有太大的反应。要是有的话，我们经常会看到的就是也是胳膊痛或者全身会痛会 maybe 发低烧。这样子也会是过夜，然后应该就是比较好起来，或者几天也就会好起来。这实际上是你的免疫系统在是一件好事情，是免疫系统在 respond， 所以我们知道vaccine 是在身体里有用。So then if I, just some more details about the vaccine. So these are more specific and you should always talk with your doctor, but if you've gotten the Moderna, the boosters will be half dose. If you've gotten the Pfizer, it'll be a full dose. Not many of my patients have the J&J, but that one is a little bit trickier sometimes. So after the J&J first dose, you can have a booster dose. Although in between, you should also probably have another dose of the other ones. So again, talking with your doctor if you have any questions is always the best idea. If you have lupus, then also super important to protect yourself in crowded places and to mask as well. So as a reminder, these patients should be extra cautious. I get a question sometimes about other medicines, which I know our IT specialists covered before, so I won't go into as much detail, but there are other medicines that patients with lupus can think about. And again, it's important to just, if you want to know about them, talk with your doctor. There's one called Evusheld, and that one is preventive. Not everyone should be eligible for these. So again, it's important that you just talk with your doctor. Briefly, I'm just seeing some questions, so let me read this really quickly. Okay, so Miss Amy Cheng says you have gotten the vaccine 4 times and each time you're sick for 4 days too, but you're fine now. Yeah, that's true. So certainly many of my patients can have reported that with each dose, sometimes that they do tend to have side effects for a few days. As I mentioned, it ranges. You can either have 0, feel just fine, or sometimes people can be sick for a few days, but you should recover. So I hope that's the case, Ms. Cheng, that you're fully recovered and feeling well. I do have a next question, which I'll ask
Dr.
Eliza.
Yu,
Yes.
sorry, we're going to go over the questions at the end.
Oh, perfect.
If you
Okay.
may continue with the presentation, please.
Got it.
谢谢。
Thanks, Eliza. Okay. Okay, so 刚才我们也讲到 specific 的 vaccine booster 的information，还是建议要是你有问题的话，还是跟医生去先通话，这样子的话，可以更仔细的 make sure 你打的是时候还有针是比较正确的。这样子只是 basic 跟大家讲一讲，就是Moderna 的话应该是booster 的时候是半针。Pfizer 应该是就是一针，J&J 比较更complicated， 所以可以跟医生再去讲讲，不过也可以打 booster 针。要是有 lupus 的话，就是也是很重要，更重要的就是应该也是继续戴口罩，然后不要去人数比较高的一些地方。你的疫苗自己的免疫系统还是已经是比较低，所以更需要注意。别的 medicine 可以用的话，就是也有一两个before 我们的 ID 的 presentation 已经讲过这些，所以我不会再重述。不过有一些可以 prevent 的medicine 有一个叫 Evershed，可以去跟你的 doctor 去讲一讲，看看你合不合适去用这些药。OK，经常的话就是除了就是中医的时候sometimes you might still get sick. So，要是when you get sick, what should you do? So this slide is mostly to cover those. So I just wanted to communicate to everyone that if you do, it's going to be okay. So number one is don't panic too much. Be at home, of course, if you know that you're feeling sick. And then the next important thing is to just call your doctors, either your primary doctor or in this case, if you have rheumatologist, your rheumatologist also. Number one is to let them know. They can always give you a little bit more specific guidance for steps. Also, if you are taking any immune system medications, then it's even more important to call them, as you might need to stop some of the medications or change them, or just have other issues that you need to discuss. So don't panic and call your doctor. But after that, so having talked about those things, I also get a question often about what basic things you can do for yourself. So because COVID is a virus, then it's very similar to other medical advice we give patients that have viruses. So a number just easy things you can do for yourself are going to be rest, make sure you're staying hydrated. If you have aches, if you feel just unwell, Tylenol or ibuprofen or Advil can all be helpful and you can use those. Oftentimes now, especially with Omicron, a lot of my patients have said they have more sore throat or cough. So being able to use cough syrup or herbal syrup to help your throat or cough is perfectly okay as well. Okay, so 要是有 COVID 的话，应该怎么办？我也想跟大家就简单的先讲一讲。第一就是不要太 panic 的话，你可以在立马我觉得应该跟你的医生去通话。所以要是你有 primary 的话 ，family doctor 可以。要是你有 rheumatology 的话，也可以这样子先通话。原因呢，就是第一呢，他们可以再跟你仔细的讲一讲应该下来该怎么办。第二呢，要是有一些药的话，也应该跟医生去讲一讲，这样子的话，有一些药需要停或者可以变一变或者减少，所以应该还是跟医生去通话。要是在家的话，你可以给自己用一些什么药？我也经常会听到这个问题，就是因为 COVID 也是个 virus， 就像跟感冒的 virus 很像的话，在家里用的一些药也就是很像，所以在家里注意的就是应该多休息，多喝水，用 Tylenol 或者 Ibuprofen 也是可以的。要是有身体发酸或者高烧的时候不舒服，可以用这些over the counter 的药。最近跟 Omicron 很多我的有一些病人也会告诉我，他们发生就是很多咳嗽或者嗓子痛，这样的话也可以用各种各样的药胶，就是 syrup 去帮助你的嗓痛或者咳嗽也是可以的。And so other things for if you get sick, just pointers include making sure that it's fine if you have a thermometer at home or a pulse ox, just to be able to have those handy if you need it. As before I mentioned prescription medications, we've talked about these in the other presentation, but you can talk about these with your doctors, and that would be Paxlovid, and then the other one was Evusheld. So Paxlovid is an antiviral pill that you can take if when you have COVID to prevent more poor outcomes, but I would recommend you discuss that with your doctor. And then otherwise, if you get sick, then the other important thing to think about is isolation and quarantine guidelines. So they can get a bit complicated and it depends on your vaccine status. So I've included some resources there, both through the CDC and the New York Gov website, but they will give you actually step-by-step cases of when you should be quarantining and how long you should be quarantining. So 在家里要是比较不舒服的话，可以make sure you get thermometer，要是需要的话，别的药我们讲过已经，就是 Paxlovid 和 Evusheld，要是有问题的话，跟医生去问一问可不可以用这些。所以还是像我刚刚说的是，要是比较身体不舒服的话，还是建议立马跟你的医生通话。第二呢，就是有 COVID 的话，现在当然也是很重要，需要去隔离。所以这个比较复杂，有时候是跟着你的vaccine status 有没有打针或者打了几针也会有变化。所以在这个 slide 上我有加有一些这些 links， 叫 CDC 和 New York Gov， 这些比较讲的也是很仔细的，就是在什么情况下应该隔离或者不需要隔离。所以第一当然也可以跟你的医生通话，不过要自己想读一读的话，这些online 的 links 也是很有用。So just looking ahead for other resources, and of course, as we're talking about getting back to normal, what are some important things to think about? So again, there actually are a lot of resources out there, and then especially here in New York City. So I've included also one link that actually compiles a lot of different language resources, including those in Chinese, and that they have a variety of different things that you can look at. So it includes tips about what to do with telehealth or other free services that are available in the city right now, and also like where to go exercise and where to be able to access some fitness resources. So I recommend taking a look at that one. And then of course, I know I've repeated this multiple times and probably sound like a broken record, but other things to do still as we're in the middle and hopefully tail end of a pandemic. It is important to go and just make sure that you're at least talking with your doctors regularly so that it can help you to transition back to normal and make sure that we're all staying healthy. So 所以现在我们在慢慢的回到比较 normal 的情况下，还应该注意一些什么别的事情，就是我也加了这个 link 在纽约 State 上的 website， 可以上面有很多不同的语言的resource， 包括也是有中文的 resource， 这样子有讲一讲就是不同的现在城市里不同的 resource 可以到哪里去安全的锻炼啊，去哪里可以拿到各种各样的不同的 service， 要是需要帮助的话。上面也有一些讲一讲，就是怎么用 telehealth。现在我不知道大家有没有这种情况，就是经常跟医生这样子通过 Zoom， 有时候也会有一点就是不方便，所以这个 website 上也会讲讲怎么去用这些不同的telehealth service。然后现在呢，就是回到我们大家希望可以健康的情况下，也是就是建议大家经常去跟医生去看一看，要是有几年没有见过 primary 的话，还是去一下。要是有专科医生的话，也应该定期去看一看，这样子可以 make sure 大家还是全体都是健康。很多人也会问我 travel 的 guidance， 我们可不可以现在去可不可以出国，或者在国内可不可以去 travel？ 要是没有打疫苗针的话，我还是建议现在先不要 travel， 先想一想。因为我们现在不同的飞机或者不同的州的话的 requirements 不一样，所以你可以你不一定可以碰着一些很多就是没有打过疫苗针的或者不知道情况的一些，所以呢，还是你自己要是没有打过疫苗，还是先想一想去至少打完了第一针、第二针，然后再去travel。现在在美国国家就是国内 travel 的话，不需要proof of vaccination。要是要出国的话，还是想把这个记着要带上 proof 你的 vaccine， 然后呢回国的时候呢，也会经常会问你先去检查一个 negative COVID 再回来，所以这样子必须要也注意一下， 省得以后出问题。所以要是在飞机上、车上在别的交通的话，我也建议继续戴口罩，因为人数比较高，像我们刚才讲过的。然后要是出国或者在国内 travel 的话，我还是建议带一个rapid test、COVID test，这样子要是不舒服的话，不在家里的时候也可以快快的 test 一下。And so travel guidance on this page I often get asked about also is, can I travel? Should I travel now? And, as we're returning back to normal, we can do some activities sort of cautiously. So if you are not fully vaccinated, if you have not had doses 1 and 2, I don't recommend you travel. Reason being is if you're traveling around, you can meet a lot of different people whose status is unknown. So I would recommend, if you're thinking about it, to at least get the 1st and 2nd doses and then think about traveling. So for domestic travel, you don't need proof of vaccine status or proof of any testing, so that is not checked. If you're traveling internationally out of the country, for example, to China, Taiwan, Hong Kong, you do need to make sure to bring your COVID status. You may need proof of a negative test, and re-entry into the US, you will need a negative test generally as well. So I do recommend that you make sure you have these documents before you travel. And from the page, I did include the CDC travel guidelines. So those are, again, a useful resource where you can check what's needed and what's not needed. Otherwise, then when on planes, cars, trains, transportation in general, I do recommend you continue to mask as they're enclosed spaces and can be a lot of people there. And if you're moving abroad or even domestically, I also recommend bringing a rapid test with you. That way, if you feel sick, you're not at home, you can just test conveniently and get some early information while you're away. Okay. So I think those are most of the things that I had to talk about. And so I appreciate everyone's attention.
Okay. So I grew up as the oldest of 3 sisters, the Jie, in a fairly traditional Chinese household. My parents were immigrants who started their own business, and they worked long hours to build their company and family. I was taught to study hard and focus on good grades and take care of my younger siblings. And you can tell by my studious appearance that I took that seriously.
係啦，呢幅相咧係我個童年照，你見到最高嗰位咧就係我係大姐姐。我屋企咧，我爸爸媽媽係移民，佢哋好努力咁樣去建立佢哋嘅公司同埋我哋嘅家庭。我哋自小咧就教導我哋要勤力讀書，攞好嘅成績，同埋要靜靜地、乖乖地，唔多點出聲，咁就係乖嘅啦。
Yes, we would come home, do homework, be busy with all of our activities, and we'd have dinner together as a family, but we were never asked about how we felt or how we're doing. And so that's why we were good girls, because we were seen and not heard. We didn't have temper tantrums or cried or expressed our emotions.
係啦，咁我哋每日放學翻嚟咧，晚晚都會同父母一齊食飯，一家人。但喺飯台上面咧，我爸爸媽媽都冇問我今日心情點啊，有冇咩困難，我哋永遠都唔會講呢啲嘢嘅。咁樣變咗我哋嘅內心諗乜嘢咧？我爸爸媽媽唔知嘅。
And I share this because growing up as a Chinese American female, mental health wasn't acknowledged and feelings weren't discussed. It had no place in our lives.
點解我特登提呢樣嘢咧？我就係想講，我哋喺亞裔文化嚟講咧，我哋冇乜特別去留意心靈健康。我哋冇提到咧，唔代表係冇呢樣嘅問題。
But we know that there's a strong mind-body connection. How we feel emotionally directly impacts our physical health and can potentially cause negative consequences. But when we feel good, we make better lifestyle choices. We move more, we smile and laugh more. So mental health is just as important as our physical health.
係啦，但係我想提呢樣嘢咧，因為我哋嘅心靈健康係直接同我哋嘅身體健康有緊密嘅交流。因為若果我哋心情唔好、心情焦慮，間接咧都會影響到我哋有身體上邊嘅病徵嘅喎。 所以我哋係好需要去正視我哋嘅情緒啊、心理嘅問題。
And having lupus is stressful. There's so much to deal with in addition to the daily responsibilities and pressures from work and school and family. So it's normal to feel depressed and overwhelmed. Lupus is unpredictable, so there's a constant uncertainty. And the past few years have definitely been uncertain and traumatic.
係啦。尤其是我哋患有紅斑狼瘡嘅病人，或者一啲長期病嘅，我哋日日都需要應付我哋呢個病情啦、食藥啦，或者身體唔舒服、好攰，咁無形中咧加重我哋嘅心靈壓力。我哋其實呢幾年或者呢排經常見到報章上邊唔開心嘅新聞，有反亞裔仇恨啦，又有啲槍支案件，更加重我哋嘅心理負擔。紅斑狼瘡呢個病係一個充滿不確定性嘅，好多時我哋都預計唔到，呢啲亦都加重一層嘅憂慮。
So a recent report published by Stop AAPI Hate, which looked at the different effects of anti-Asian racism on mental health among Asian Americans during the pandemic, found that Asian Americans were more stressed by anti-Asian hate than the pandemic itself. So those that experienced racism had heightened symptoms of depression, anxiety, stress, and physical symptoms.
係啦，你喺熒光幕上邊見到一個圖片，其實就話俾大家聽，早統計嚟講，我哋亞裔人士係驚反亞裔仇恨呢樣嘢多過驚呢個疫情嘅。更加擔心。
So clearly, COVID and anti-Asian hate have taken a toll on our mental well-being. But how come we don't get help? We go to the doctors for headaches and stomach pains. What about the pain in our hearts and our heads? AAPI have the lowest help-seeking rate of any racial ethnic group. But why do we suffer in silence?
係啦，但係我哋見到數據講，我哋好擔心呢個反亞裔仇恨，擔心呢個疫情，亦都好多人因為呢樣嘢影響到佢哋嘅心理健康。點解我哋唔去尋求幫助呢？我哋平時有頭痛、有胃痛，都會去識得睇醫生，但係我哋心入邊有痛楚，點解唔去正視呢？我哋亞裔人士比起其他美國人係屬於最少最低去尋求幫助嘅族裔，我哋往往咧都默默中咁樣去承受。
Is it because we feel ashamed or embarrassed about our struggles? Is it because we think it's weak to need help or ask for help? You're depressed, just get over it. Tough it up, just feel better.
咁點解我哋要去默默承受呢？會唔會以下呢啲原因？第一，覺得好羞辱，有精神病，好尷尬，唔想人哋知道我哋嘅掙扎，或者會唔會呢個係一個弱者嘅表現？如果有情緒低落，啲人會通常同我講：唔好咁強壯啲啦，唔使咁弱嘅，好快就冇事㗎啦。會唔會係咁解呢？
Is it because we were taught not to complain? We feel guilty about burdening others?
會唔會係因為我哋由細到大家庭教我哋唔好咁容易抱怨，唔好咁容易去投訴，或者會唔會係因為我哋若將自己嘅負擔交俾其他人嘅時候，會感到有啲罪惡感，有啲內疚。
We think if we seek help, it looks bad on us and our family, because we were taught that things stay in the family. You don't want to air your dirty laundry and have others look down and think negatively of you, right? That would be a loss of face.
另外咧，喺亞裔家庭嚟講咧，好多時都顧及面子，因為 我哋有啲唔開心或者有啲病啊，唔想俾外人知，會影響到人哋睇我哋成個家族嘅家聲，所以就唔會去不但止唔去尋求幫助，仲收收埋埋喺屋企入邊，呢個亦都係一個原因嚟嘅。
Or is it because we think mental health treatments don't work? Or as my mom likes to say, what's the use of talking about it?
會唔會我哋成日以為去尋求心理輔導根本係冇用嘅？正如我媽咪成日講嚟做乜嘢啊？冇用嘅。
There are a lot of reasons holding us back from finding help. But the next time you're feeling overwhelmed, consider why. Because it can hurt you to stay silent.
係啦，你見到以上種種原因都導致我哋去有猶豫嘅，唔想出去揾幫助嘅。我希望你哋下一次覺得心入邊好沉重嘅時候，問一問自己，我係咪應該默默去承受呢？
Your mental health is part of your everyday, how you feel, how you react. Again, it affects your mood, your choices, and your physical health. If your mental health isn't well, it's not because you're sangging or crazy. It doesn't mean that you're less of a person, that you should be ashamed. Mental health, just like your physical health, is something that you can maintain and pay attention to on an ongoing basis.
其實咧，心理健康咧係你每日嘅一部分，你嘅感覺點樣就會影響到你做嘢嘅反應。你嘅心情唔好，亦都會影響到你每日生活嘅選擇，影響到你身體上邊嘅症狀。如果你個心入邊有負擔嘅話，或者有啲諗唔開嘅嘢，唔代表你係俗語稱嘅神經。你唔需要顧及人哋點樣睇，或者會覺得你要好羞恥啊！你個心理有問題，係唔係嘅？點解呢？因為心理健康就等於你身體健康一樣咁重要。你兩樣可以兼備嘅話呢，咁你先至可以完完全全過一個正常健康嘅生活。
So what can we do to keep our mental health strong? Well, first of all, you can express yourself. And that means expressing yourself verbally, either to a friend or a family member, or a therapist or a support group. It means expressing yourself creatively, means painting or playing an instrument or writing a poem. It means expressing yourself physically through dance or tai chi or boxing.
係啦，咁我哋應該點樣去改善我哋開心啲心情呢？第一，去諗下點樣去表達自己。我哋可以用語言去表達啦，例如同朋友、家人或者心理輔導員傾偈啦。我哋可以用創意，可以用繪畫、音樂或者寫作去發揮自己入邊嘅心情，亦都可以用身體語言，例如去跳舞、去運動、瑜伽、boxing 都可以去表達你自己。要俾多啲時間去照顧自己。
That's exactly the next thing, time. Time for yourself, whether that's a few minutes or a day or more. Do something that gives you peace, that gives you joy. Go out in nature, go listen to music or sing.
係啦，所以你要好多時間要留返一段屬於你自己嘅時間。譬如你可以做一啲令自己快樂、自己平安嘅活動，去郊外散步，聽一啲輕鬆嘅音樂等等。
And we all know that the benefits of exercise are wide-ranging. I mean, we just did some breathing and stretching exercises with Master Chen. Didn't that make us feel looser and calmer?
係啦，好多活動咧都可以令自己鬆弛嘅喎。正如剛剛我哋跟秦師傅做咗一個八段錦，大家係咪覺得身舒筋活絡同埋心情輕鬆咗咧？
And take time to build connections. Interacting with others can improve our mental well-being, assuming you don't always pick fights and argue all the time.
同埋咧，我哋要花一點時間去聯繫其他朋友或者親人，去有一個溝通，有一個交流。
And share your kindness. When you volunteer to help someone, it has a positive effect.
同埋咧，好多時你要本住一個善良嘅心。當你用一個善良嘅心去對人哋咧，人哋亦都會有回饋，用返善良嘅心去對待你嘅。
And maybe follow a meditation or mindfulness or gratitude practice. These have all been proven by scientific research to have a direct link to happiness.
其他我可以介紹嘅方法，譬如去做冥想啊，做一啲正念嘅修法啊，或者去經常感恩啊，呢啲咧喺科學嘅研究上面咧，都可以幫助我哋保持心平氣和嘅。
We work so hard at maintaining our health, especially with lupus. We pay attention to our medication schedule, how much we exercise, what we eat. We equally need to pay attention to our feelings and how we're processing our emotions.
係啦，我哋患有長期病，好似紅斑狼瘡嘅朋友咧，我哋好努力咁樣去維持身體健康，記得準時食藥，記得準時去睇醫生。但係我哋亦都要留意，花時間去睇下自己個心情、自己嘅心理、心靈嘅健康係咪一樣咁好喎
So whether you've joined one lantern event or 10, and some of you are in this category, you already know how beneficial it is to connect with other lupus warriors. In addition to Lantern, there are other organizations and nonprofits that offer support and resources. So I encourage you to prioritize your mental health. And if you're finding things difficult, reach out to a friend or family member or professional therapist. Have a conversation. You don't have to keep things inside and struggle alone.
係啦，所以我好鼓勵大家咧，伸手去需要同人溝通啊，需要幫助嘅時候，我哋伸手出去。我而家喺熒光幕展示俾大家睇咧，就係一啲支援服務。我哋有中英文，有服一啲紅斑狼瘡嘅病人同埋家屬互相交流分享，係對病情咧好有直接幫助嘅。記住啦，唔好默默承受。我哋應該多啲向外同人溝通，將心入面嘅説話開發出嚟，咁樣先至可以有一個健康嘅內在同埋外在嘅。
So yes, just to close, I know there's a lot of uncertainty, but the more we learn to improve our health, both physical and mental, the more confidence we can have in ourselves, and the better we will feel, both inside and out.
好啦，我今日總結之前咧，想話我哋而家面對好多不確定性嘅前景，亦都好多唔好聽嘅新聞，但係我哋一定要記住一樣嘢，要好好咁樣照顧好自己嘅心靈健康，因為呢樣嘢係令我哋整個人健康愉快嘅其中重要個環節。多謝。